Here's something your doctor might not have time to explain. After 60, not every medical test recommended is actually necessary for everyone. In fact, medical organizations like the American Board of Internal Medicine have identified over 50 common tests that are frequently overused in older adults. A 2022 study in JAMA Internal Medicine found that up to 30% of medical tests ordered for seniors without symptoms provided no meaningful benefit and sometimes led to unnecessary follow-up procedures. But here's the important part. This isn't about avoiding healthcare. It's about being a smarter healthcare consumer. Knowing which tests truly protect your health and which ones you can safely skip based on your individual situation. Today, we're breaking down 5 commonly overused tests after 60, what the medical evidence actually says, and the questions you should ask your doctor before saying yes. Drop your age in the comments and let's have an honest conversation about smart healthcare decisions. Bone density scans, called DEXA scans, are valuable tools for detecting osteoporosis. But after age 75, routine repeated screening may not benefit everyone, especially if your bones are already healthy. Here's what the evidence shows. The U.S. Preventive Services Task Force recommends bone density screening for women up to age 65 and suggests individualized decisions after that. For adults over 75 with no history of fractures and previous normal scans, annual rescreening often doesn't change treatment decisions. A 2020 study in the Journal of Bone and Mineral Research followed 1,400 women over 75. Those with normal bone density at age 70 had less than 2% chance of developing severe osteoporosis within the next 10 years. The conversation to have. If your last DEXA scan was normal and you have no risk factors like previous fractures, steroid use, or significant height loss, ask your doctor, do I really need another scan? Or can we focus on prevention through exercise and nutrition? Weight-bearing exercise, adequate vitamin D and calcium, and fall prevention strategies often provide more benefit than repeated testing. Important note, this doesn't apply if you have risk factors. If you've had fractures, take bone-weakening medications, or have significant bone loss, regular monitoring makes sense. The key is personalization, not blanket rules. Breast cancer screening with mammograms has saved countless lives. But after 75, the decision becomes more nuanced and should be based on your overall health, not just your age. The U.S. Preventive Services Task Force states there's insufficient evidence to recommend routine screening mammograms for women over 75. That's not because breast cancer stops mattering. It's because the balance of benefits and potential harms shifts. A 2021 analysis in Annals of Internal Medicine examined mammogram outcomes in women over 75. For women with serious health conditions or limited life expectancy, less than 10 years, screening found cancers that would never have caused symptoms in their lifetime. Meanwhile, the follow-up biopsies, anxiety, and potential overtreatment caused real harm. The real consideration? If you're 76 and in excellent health, active, and have a family history of breast cancer, continued screening might be appropriate. But if you have multiple chronic conditions or limited mobility, the calculus changes. Questions to ask your doctor. Based on my overall health, what's my realistic life expectancy? If we find something, would I be healthy enough for treatment? What are the chances this screening will improve my quality of life? This is about informed choice, not age discrimination. Some women over 75 should continue screening. Others can safely stop. Your doctor should help you decide based on your individual situation, not a one-size-fits-all policy. Cardiac stress tests, where you walk on a treadmill while your heart is monitored, are valuable when you have concerning symptoms, but they're increasingly overused in older adults with vague complaints like feeling tired or not having as much energy. The problem is accuracy. In adults over 70 without typical heart disease symptoms, stress tests have a false positive rate of 30 to 40%. That means the test suggests a problem when none exists. A 2018 study in JAMA Cardiology tracked 5,000 Medicare patients who received stress tests. Over half who tested positive underwent invasive follow-up procedures like cardiac catheterization, but fewer than 15% actually had significant blockages requiring treatment. The unnecessary procedures carried real risks: bleeding, kidney problems from contrast dye, and hospital-acquired infections. What symptoms actually warrant testing? Chest pain or pressure during physical activity that stops with rest. Significant shortness of breath during activities you used to do easily. Dizziness or near fainting during exertion. What usually doesn't? General fatigue, occasional tiredness, vague chest discomfort unrelated to activity. Better first steps. Before jumping to a stress test, your doctor should do a resting EKG, simple, no risk. Check for anemia, thyroid problems, or medication side effects. Evaluate sleep quality and depression. A coronary calcium CT scan is another option. It's a simple imaging test that shows if dangerous plaque is building up without the risks of a stress test. Ask your doctor, are my symptoms typical for heart disease, or should we check other causes first? Colonoscopy screening has dramatically reduced colon cancer deaths. It's a proven, life-saving test. But timing matters. The U.S. Preventive Services Task Force recommends stopping routine colon cancer screening at age 75 for most people. After 85, they recommend against screening altogether. Why? Because colon cancer typically grows slowly. A cancer detected at age 76 might not cause problems for 10 to 15 years. Meanwhile, colonoscopy preparation, strong laxatives, and sedation carry increasing risks with age. A 2019 study in Annals of Internal Medicine analyzed over 1.3 million Medicare colonoscopies in adults 70 plus. The complication rate, bleeding, perforation, cardiovascular events, was 5 to 8 and 10 times higher in adults over 75 compared to those in their 50s. The nuanced decision: if you're 74, healthy, and never been screened, definitely do it. If you're 76 with a family history of colon cancer, discuss it with your doctor. But if you're 78, have had 2 normal colonoscopies, and have heart disease or diabetes, the risks likely outweigh benefits. Safer alternative: the FIT test, fecal immunochemical test, is a home stool test that detects hidden blood. It's not perfect, but it's safe, requires no preparation, and catches most significant cancers. For older adults at average risk, it's often the smarter choice. Questions to ask: when was my last colonoscopy and what did it show? Given my age and health, do guidelines recommend screening? Would a FIT test be appropriate instead? This isn't about avoiding care. It's about matching the test to your individual risk and health status. This is the big one. Full-body CT scans or MRI scans are increasingly marketed as executive health screenings or preventive cancer detection. They sound appealing. Who wouldn't want to catch problems early? But here's what medical organizations agree on. Whole body imaging in healthy people without symptoms does more harm than good. The American College of Radiology, American College of Physicians, and U.S. Preventive Services Task Force all recommend against these scans. Why? A 2023 study in JAMA examined outcomes from 10,000 full-body CT scans in asymptomatic adults over 60. Over 85% found incidental findings, spots, nodules, or abnormalities that required follow-up. But 98% of these were either benign or clinically irrelevant. The problem? Once something is found, it must be investigated. That means more scans, biopsies, anxiety, and sometimes surgeries for conditions that would never have caused harm. The radiation risk. A full-body CT scan delivers radiation equivalent to 500 chest X-rays. For older adults, this radiation exposure increases cancer risk by approximately 0.5% per scan. That might sound small, but it adds up, especially with follow-up scans. A modeling study estimated that increased CT scanning may now contribute to 2 to 3% of all cancers. When imaging makes sense, Targeted imaging based on symptoms or risk factors is different. If you have unexplained weight loss, persistent pain, or abnormal lab results, focused imaging is appropriate and often life-saving. The red flags of scan marketing. Promises to catch cancer early. No discussion of false positives. No conversation about what happens if something is found. Marketed directly to consumers, not through your doctor. What to do instead? Maintain regular checkups with your primary care doctor. Get evidence-based screenings appropriate for your age. Colonoscopy, if under 75. Mammograms, if appropriate. Lung cancer screening, if you're a current, former heavy smoker. And basic health monitoring. Your doctor can order targeted imaging if your symptoms warrant it. Questions to ask if offered a full-body scan. What happens if you find something? How often are findings serious versus benign? What medical organizations recommend this test? Here's the truth about medical testing after 60. More isn't always better. The goal isn't to avoid healthcare, it's to be strategic about it. The best healthcare decisions are made through conversation, not assumption. Your doctor should explain why a test is recommended, what will happen if something is found, and what the alternatives are. Questions to ask before any test. Why do I need this test now? What will you do differently based on the results? What are the risks of the test itself? What happens if I wait or skip it? Good doctors welcome these questions. They want you to be an informed partner in your care. Remember, declining a test doesn't mean you're refusing care. Sometimes the most responsible decision is to watch, wait, and focus on lifestyle measures that we know work. Staying active, eating well, maintaining social connections, and managing existing conditions. Now I want to hear from you. Have you ever questioned whether you needed a test? How did your doctor respond? Share your experience in the comments. If this helped you think differently about medical testing, share it with someone who needs to hear it. Thanks for watching, and here's to making smart healthcare choices together.